Homeopathy, a system of alternative medicine founded in the late 18th century by Samuel Hahnemann, operates on the principle of like cures like. This philosophy posits that a substance that causes symptoms in a healthy individual can, when administered in extremely diluted forms, treat similar symptoms in a sick person. While homeopathy has its critics and is often met with skepticism in the scientific community, many individuals report positive outcomes for a variety of ailments. Understanding the diseases that homeopathy can benefit and the cellular mechanisms behind these benefits requires a nuanced exploration of both the practice itself and the broader context of health and disease. Homeopathy has been traditionally used for a range of conditions, including allergies, asthma, migraines, arthritis, and digestive disorders. Many patients have found relief from chronic issues such as eczema, sinusitis, and even the common cold through homeopathic remedies. One of the appealing aspects of homeopathy is its holistic approach, considering not just the physical symptoms, but also the emotional and psychological states of individuals. This is particularly relevant for conditions like anxiety and depression, where homeopathic treatments may alleviate symptoms by addressing the underlying emotional turmoil. In the realm of allergies, for instance, homeopathy may provide relief by utilizing remedies that correspond to the specific allergen triggering the immune response. For example, a homeopathic preparation derived from pollen might be used to treat hay fever. The proposed cellular mechanism here involves the modulation of the immune system's response. Homeopathic remedies are believed to stimulate the body's own healing processes, potentially enhancing the regulation of histamine release and other inflammatory mediators that contribute to allergic reactions. This could lead to a more balanced immune response, reducing the severity of symptoms. Asthma, another condition where homeopathy is frequently employed, may also benefit from this approach. Homeopathic treatments often aim to improve lung function and reduce inflammation. The mechanisms might involve the regulation of bronchial smooth muscle tone and the modulation of inflammatory pathways. Some studies suggest that homeopathy may influence the production of cytokines, which are crucial in mediating inflammation and immune responses. By potentially enhancing the body's ability to manage inflammation, homeopathy might help asthmatic patients experience fewer exacerbations and improved overall lung function. Migraines are a common ailment that many individuals seek homeopathic treatment for. The remedies are tailored to the individual's specific symptoms and triggers, which could range from stress to dietary factors. The proposed cellular mechanisms in this context may include the modulation of neurotransmitter activity, particularly serotonin, which is known to play a role in migraine pathophysiology. By influencing serotonin receptors or other signaling pathways, homeopathic remedies could help stabilize the neurovascular changes that lead to migraine attacks. Arthritis, encompassing various forms of joint inflammation, is another area where homeopathy has shown promise. Homeopathic treatments may aid in reducing pain and improving mobility. The cellular mechanisms at play could involve the modulation of inflammatory processes within the joints. By influencing the activity of immune cells and the release of pro-inflammatory cytokines, homeopathy may help alleviate the chronic inflammation characteristic of arthritis, leading to improved joint function and a reduction in pain. Digestive disorders, such as irritable bowel syndrome, IBS, or gastroesophageal reflux disease, GERD, are also commonly treated with homeopathy. The remedies often focus on the individual's specific symptoms, whether they be bloating, pain, or altered bowel habits. The proposed mechanisms might include the regulation of gut motility and the modulation of the gut-brain axis, where emotional stress can exacerbate gastrointestinal symptoms. Homeopathic treatments could potentially influence the microbiome or the secretion of gastrointestinal hormones, promoting a healthier digestive environment. Eczema and other skin conditions are frequently addressed through homeopathy as well. The remedies are selected based on the individual's specific skin symptoms and overall constitution. The cellular mechanisms may involve the modulation of immune responses in the skin, particularly in relation to the Th2 immune response, which is often exaggerated in allergic skin conditions. By helping to balance this immune response, homeopathic treatments might reduce inflammation and promote healing of the skin. The common cold, while often self-limiting, is another area where homeopathy is frequently sought. Remedies are chosen based on the individual's specific symptoms, whether it be a runny nose, sore throat, or cough. The cellular mechanisms involved may include the modulation of the immune response to viral infections. Homeopathy could potentially enhance the activity of immune cells, such as macrophages and T cells, leading to a more effective response to the viral pathogens responsible for the common cold. While the scientific community remains divided on the efficacy of homeopathy, with many studies indicating a lack of robust evidence, it is essential to recognize the subjective experience of patients. Many individuals report positive outcomes from homeopathic treatments, often attributing their improvements to the holistic approach and the individualized nature of the care they receive. The placebo effect, which can be powerful in its own right, may also play a significant role in the perceived benefits of homeopathy. Homeopathy has been utilized for a variety of diseases, including allergies, asthma, migraines, arthritis, digestive disorders, skin conditions, and the common cold. The proposed cellular mechanisms of action involve the modulation of immune responses, inflammation, and neurotransmitter activity, among others. While the scientific validation of these mechanisms is still a topic of ongoing debate, the individual experiences of patients highlight the potential benefits of homeopathy as a complementary approach to health and wellness. As research continues to evolve, it is crucial to maintain an open dialogue about the role of homeopathy in modern medicine, recognizing both its historical significance and the need for evidence-based practice.